you. So when we talk about, this is an important topic, critical appraisal of the medical literature and audit. So actually, critical appraisal of medical literature is a core competency in various modules within the curriculum. In any exam, be it RCOG, RCPI, American or Arab board, Saudi board, European board, they all want you to understand the literature. So critical appraisal questions, they will be basically in one of the 5 categories. Like they will ask you about therapy studies like randomized controlled trial and studies, then diagnostic studies where we want to see that the test is accurate or not, then systematic reviews and meta-analysis, because meta-analysis gives us the highest level of evidence which is based on the systematic reviews, and it's critical to differentiate between these two types. Then patient information leaflets that we did before, and audits. So it is possible to be presented with other types of studies. For example, one on prognosis, like cohort studies, basically when we want to see that how the patient will do in the long run, or how the patients did in the long run. Like we said, cohort studies, they can be prospective or retrospective. So prognosis, basically where you are commenting on prognosis, that will be based on a cohort study, because you are selecting a group of people and following them. Then if you have to find out the cause of disease, etiology, then you will do case control study or again cohort study. Or if you want to see how efficient a drug or intervention is, then you have to do economic evaluations, but usually this is not your job. This is job of the quality control departments. So now in the exam, what will happen? You will have a preparatory station, and they will ask you to appraise medical literature or design an audit, and then present the findings or suggestions at the subsequent stations. So you can also be asked to interpret a short abstract, appraise a short patient information leaflet, or be asked to describe how you would design an audit. Therefore, if the need arises, the principles provided in this chapter, you will have to modify them according to the question. So now you can ask a question that why do we have to appraise the medical literature? So as you know that many medical papers are published in medical journals, and they have serious methodological flaws, and most are irrelevant for everyday clinical practice. And many of the doctors in the user mode, they look for evidence to support the practice. And you cannot always find a good or up-to-date or valid reappraise summaries and synopses. So, and it becomes necessary to switch to appraiser mode. So what you have to do, you have a question, you are not finding the answer, so now you have decided to help yourself. So how this process starts, this is just like any scientific method. This process starts with definitely the exact clinical questions you want answered. You have a question, so you need an answer, and you didn't find something in the previous paper, so now you will look for a new paper, and then you will only then does appraising them it will become an issue. However, as you will be given the paper for appraisal in the OSCE, the steps of defining the question and searching and finding the literature, it will not be relevant. So only what they will do, they have given you some appraisal, so then you need to check that is this a valid document. Why? Because was the correct method used for analysis, validity is there, then what is the importance? Is it a statistically significant reduction in BP of 2 mm mercury clinically significant or not? Then is it applicable to my patients or not? So there are many checklists for appraisal of different types of clinical questions, and we will do the important topics here. So basically we should see that what is the structure of a medical paper. So most scientific papers, they will have a definite structure. We call that in red, like introduction or the background, what method was used, what were the results of findings, and what is the discussion on that topic. This is the, you will find this pattern in like 80% of the journals. So they often have an abstract which is also usually structured as I'm read. All of these sections, they are important, but some are more important than others. So which are the important ones? So it may seem an academic question, but it is not. If you are struggling to make sense of lengthy article due to time limitation in your OSCE, you will need to prioritize what you read. Don't read everything. So what you will see, you should first of all look at the abstract, method and result. No need to go to the introduction or the background, they will not ask you. Abstract is very important because it should give you a quick overview of the paper, and the methods, they will tell you that what was done in the study and from which you can assess its validity, and the results should tell you what was found. What about the introduction and the discussion? That we know many of you are fond of devoting a lot of time to. If time permits, by all means do read these, but these are secondary to the abstract, method and result. So focus on three things. What is the abstract? What methods were used for analysis and results? Then there are general principles for appraising a medical paper. So what is the first step? Introduction. So introduce the paper and your purpose. Then you should say, I would like to present the appraisal finding of this article by, mention the name of the author and colleagues. For instance, it was Dr. Ian. You will say that it is written by Dr. Ian and his colleagues. It is published in like Saudi Journal of OB/GYN or European Journal of OB/GYN in the year. You will have to tell that when it was published and what is the subject. Then this is a paper, so you will say that I will summarize the appraisal finding, highlighting the study's strength and weaknesses, and conclude with my interpretation of the finding in terms of implications for clinical practice and for research. In second step, you need to define the exact clinical question which is asked by the paper. So the way to define a clinical question is by using the PICOD structure, and you can often get all elements of MRCOG from the abstract, although sometimes it is necessary to go through the method section to find that all the relevant information. Once you have identified your elements of PICOD, put these all together succinctly in a statement for your examiner. For example, you should say a sentence like this. This randomized controlled trial evaluates the effectiveness of low-dose aspirin compared to a placebo on the outcomes of preeclampsia and perinatal mortality in women at risk of preeclampsia. So that is the purpose, so you should identify that. Then in next step, you should give some detail. So what you have to do, that you should look at the inclusion and exclusion criteria. The purpose is to provide more detail on the PCOD. For example, in this study, you can say like this, in this study, high-risk women, so high-risk women, they are the population sample for your study. They were defined as women with a previous history of preeclampsia, chronic hypertension or diabetes, and those who had positive uterine artery Doppler at 12 to 14 weeks gestation. And the intervention was aspirin at a dose of 75 mg, started at 14 weeks gestation and continued until 36 weeks. The primary outcomes were preeclampsia, which is defined as, and then perinatal death, which is defined as, and then the secondary outcomes were. So basically a study is not going to answer just one question. It will address your primary question, your secondary questions, and then the subsequent issues. So in this group, they included the women in whom they did this uterine artery Doppler between 12 to 14 weeks, and they found kinking or some other abnormality. And they thought that this group is at a higher risk. So they started them on prophylactic aspirin. So you will have a pencil in your hand and you will have this paper, so you are going to highlight all the points, okay? Then you should comment on them. But first, if you will give good introduction in the abstract, then you are going to be fine. Then you will have to appraise the study for validity. So all the information you need for this will be found in the methods section. Checklist that will help you with the appraisal of three common types of articles. They are provided in the discussion. It is important to approach your paper with a checklist like these in your mind. Then your reading of the article, it will be purposeful and focused as you gather the facts to answer the questions in the checklist. You can then summarize the output from this exercise. For example, this is you can say this is a randomized allocation concealed placebo control double blind study. Randomization was achieved with the use of a computer generated random number list. Allocation concealment was accomplished by placing the treatment allocations in opaque envelopes. Both the clinicians providing the care and the patient, they were blinded, making the study double blind. The analysis was by intention to treat and the follow-up rate was excellent, with data being available on over 95% of those who were randomized. Thus, the method of this trial are excellent. Of course, if there are any weaknesses in the method, you will highlight these also, and this step is the backbone of your appraisal. So you need to do a good job and don't rush, okay? Just because method, you will focus on the method, okay? Summarize that. You will get all the information, just underline that. Don't try to write on a separate paper because it will be hard, okay? Don't waste your time. Then provide the findings. You will find all that you need to address this step in the results section and the tables and figures of the article, and then you will say that in the table 1 in the most articles is where researchers summarize data on demographic and baseline characteristics of the population. They should be compared. So you should start with this, that will define your sample, what was done, what was the age group, what was the parity, and what were the weeks of gestation. Everything will be in the first table. Then move to providing the study findings. Provide confidence intervals around the findings where these are provided. For example, the baseline characteristics between the aspirin and placebo groups were similar. The main findings were that there was a reduction in preeclampsia risk with a relative risk of 0.6 and a 95% confidence interval from 0.5 to 0.8. And the study also found that, then you will continue, then you will tell about the other findings of the studies which were not included in our questions. Like usually one study will be there and there will be one, two or three primary questions. So when you are trying to find the answers, you will discover many other facts and then you will say that those are the secondary informations, additional information, okay? So then in the next step, you should put the study findings in the context of the existing evidence. So a judgment can almost never be made about the value of an intervention or test based on paper alone, one paper alone. You need to weigh up the balance of evidence. For this step, you may find the discussion section of the article helpful. If the authors, they have taken the trouble to place their study in the context of existing evidence. Unfortunately, discussion section of articles is generally abused by authors. They shamelessly fill it with irrelevant curiosities that they were unable to place elsewhere and often put spin over their findings. So skim through the discussion. But if you find that the authors have written about previous studies on this subject, stop and take this in. Hopefully, using the information in the discussion and your pre-existing knowledge, you can put the study in context. If you cannot, you may have to state to the examiner that you would want to find out more about what other studies on this subject show before you could decide on whether the evidence should be incorporated into clinical practice. Your efforts to produce something of this sort, you will say, the findings from the study are consistent with over 40 other studies summarized in a Cochrane review. But if they have not given you any reference that in past how many studies were done on the subject, then you can say that in the discussion section the author has not given reference of many studies or have not told us that what is the existing evidence, that what information we have on the subject right now. So it is hard to comment on the condition. Yeah. Mm-hmm. Yeah. Yeah, you can use anything, you can use that. Even if the review is there, you should be able to comment on that. I mean, that's why I'm telling you that you will have to focus on certain things, because even these are all present even in a systematic review. Okay, because there is a standard methodology. So then after reading everything, you can make your recommendations for practice and research. So, as you know, there is no benefit of appraising a paper unless you come to some judgment about whether it is appropriate for guiding a clinical practice or further research is required. Okay? So, previous comments, like in the we did in the section 4, 5, and 6, they will also help you in making your judgment. And how you will tell the examiner, you will say, as this study is a high quality study and it shows substantial reduction in preeclampsia and prenatal death, and the findings are consistent with other studies on this subject, I will recommend aspirin therapy to women at risk of preeclampsia. So this is the clinical implication of the study, that if you have done something, you have found the answer, and the study you have read, it is supported by medical evidence in the past, like from another 5 studies, then you will say this study has good evidence for practice, so I'm going to do the same thing for my patients. Like in this case of preeclampsia, you will say I will give aspirin to my patients because now we have enough medical evidence that this one is a good intervention. Then further research may be required to examine the role of aspirin in other high-risk groups such as those with renal disease. Because I said that many things will be there, so you are answering the primary questions and trying to find the answers for other questions also. So then if they give you a randomized controlled trial, then there is a checklist to appraise a therapy article. So you will say first question will be, are the results valid? So what are the questions? Is the assignment of patient randomized? Like appreciate methods are random member tables and computer generated random numbers. Then is the allocation of patient concealed? This is appropriate methods are opaque envelope, then third party randomization, and then distant like telephone or the internet allocation. Then are patients health workers and study personnel blind to treatment? Then are patients analyzed in the groups to which they were randomized? So this is intention to treat analysis. Then are all patients who entered the trial properly accounted for and attributed at its conclusion? Then is for yeah, 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 yeah. It will be like all the patients were there, and then it is simple. You will say that first of all you will take patients, okay? Then we know that for the randomized control groups, for the randomized control trials, we will, why the name randomized, because we are going to put them randomly, not in a planned manner, just we are putting some patients some here and some there, okay? So the what are the appropriate methods, like then you will put them into the random tables, or you can put them in random numbers according to the computer numbers. So you don't know basically about the identity of the patient, and you will not know that who is getting treatment and who is not getting treatment, so they will be mixed. The purpose is that the treatment group and the control group is the one who is not getting any type of intervention, we are only observing them, okay? And the treatment group is the one where you are giving them some treatment, or you are doing some intervention, like you are doing some procedure, okay? So basically randomized controlled trials you are going to do where you want to see that is some therapy helpful or not, okay? That is the point. So you have you have a control group, and then you have patients. Then patients should be randomized. Then we should know that is it blinded. Concealed means blinded. We know that it can be like single blind or double blind or triple blind. Okay, single blind, when the patients and the control group, they don't know that who is getting the treatment and who is not getting treatment, but the doctor knows. Okay, then there is another type, double blind, where the doctor doesn't know and even the patient doesn't know. So this is double blind. So they will just see that if someone is showing improvement, then only the researcher will come to know that this patient was getting treatment or not. Then the third type will be where even the researcher, they will not know that who is getting the treatment and who is not getting that treatment. Okay? So only those who have designed that study, they will know that who was getting treatment, who was not getting, and what treatment exactly they were getting. So then patients, health workers, and study personnel, they are blind to treatment. That none of the three, that no one of these three people know that who is what is being done. They are just given the questionnaire and they are answering the questions. Then are patients analyzed in the groups to which they were randomized. This is like if the patient was in the control group, no intervention, then they will be assessed in a different way, and then those who are getting treatment, all of them, they will be assessed. So this is intention to treat analysis. Then are all patients who entered the trial, they are properly accounted for. We know that who is where, and who has been included, who has been concluded, who has reached the conclusion, okay, the end stage. Then is follow-up complete? Because what happens, some people, if they have any problem, they will drop out of the study also. Okay, so then you will have to see that how many they left the study before it was completed. Then are the groups similar at the start of the trial? Okay, so this will be given in the first table. So if the groups are not similar, like you want to see the effect of aspirin and in prevention of preeclampsia, and you have taken two groups. One group is having girls, which ladies which are like between 15 to 30 years of the age, 15 to 20 years of age, and then you have a second group who are between 25 to 35. So as you know, preeclampsia will be more common at extremes of age, in the very young and in the very old. So groups are not the same, right? Then aside from the experimental intervention, are the groups treated equally? Like, are they getting the equal number of antenatal visits? Then is the antenatal care provided at the same place by the same people who have same qualification, same experience, or there are any differences? And then was the study adequately powered? Study of the power, it will increase as the number of the persons included in the study will increase. Then was ethical approval, that study of the power will increase if you have more patients. If you have like only 20-30 patients, then the power will not be good. Okay, so 50 patients, more powerful study. 500 patients, even more powerful. Then in each hospital you have one ethical committee. So before you start any study, you need to take approval from the this ethical committee. So actually you are writing a request, you are writing down the purpose of study, and then the hospital ethical committee, they will sign that one and they will say, okay, this is an ethical study. Then you should know what are the results and what is their importance. So then why it is important? Because you want to see that if we gave one treatment, then how many patients were cured, how many patients were treated, so how large is the treatment effect. So this is reported as relative risk, odds ratio, absolute risk, or numbers needed to treat. Then how precise is the treatment effect? Precise means that it means that you are taking 95% confidence interval. So if 95% confidence interval is very large, so it means that the results are not so good. Okay, because they are spread over a large number. So if the narrow confidence interval means that the results are more precise. Then third question is, will the results help me in caring for my patients? That is, that knowledge or the result of that study outcome is helpful if you want to do something for your patients. So can the results be applied to my patients? Then are all clinically important outcomes considered? Then what are the likely benefits, and are they worth the potential harm and cost? Because no intervention is without risk. You will have some benefits and you will have some risks. So and then everything is going to cost money, so you have to make an overall decision that is this intervention helpful. Is it if it can cause harm in 10 patients but 90 patients they will benefit, then you will say, yeah, it is good, we can take this risk, because no treatment is 100% successful. So then these items, they do not strictly relate to validity, nevertheless they are important and they should be part of the appraisal process. Then if you have, that is all about system RCT. So today when we will finish this one, you have to learn all of these points very well, okay? Listen to this audio like audio video 2-3 times so that you will have clear concept, and then before your exam also you need to listen to them. Okay, if then you have an article which is focusing on the diagnosis, we will say that this is a diagnosis article. So if you want to appraise that, then there is another checklist. Checklist means that then you have to find that all of these things have been done. So first question is, are the results valid? So does the patient sample include the appropriate spectrum of patients to whom the test will be applied in clinical practice? Then what the best and what the test and reference standard, or which is the gold standard, which is the most helpful one. So the question is, were the test and reference standard results obtained by assessors blinded to each other? Like two persons we are assessing and we should not know that which test references is we are going to use there. Then did everyone get both the test and the reference standards? Then is the test described fully? Then is the reference standard described fully? So everything should be described, because you should know that when you will say that this patient is getting benefit from the study, when you will reject that one, when you will say that no, my patient is not benefiting. So you have to set a level, okay? Then second step is, what are the results? So what are the results? You know that for a diagnostic test we use the terms like sensitivity, specificity, predictive values, or likelihood ratios. Then what is their precision? Precision means that you should tell about their 95% confidence interval. Then will the results help me in caring for my patients? So for this you need to ask some questions. Are the results applicable to my patients? Then number 2, will the results change my management? Then will patients be better off as a result of the test? So it is better that not to do this test for these patients. So you need to remember these boxes and just learn these points, okay? And then you will analyze something. So if they give you a meta-analysis, then what is the checklist? So first of all, are the results valid? Does the article address a clearly focused questions? Then these elements of PICOD, that all of them are clearly defined. Then are the criteria used to select article for inclusion appropriate? Then is the literature search comprehensive? This Medline, Embase, Cochrane, General, and searches for abstract and hand searching, etc. Is this helpful? So you are going to remember all of these, because we'll say Medline and these, because we are reading about them on every single day. So is the validity of the included studies appraised? So you will check that is the study good, is it valid, or it is outdated, or it is irrelevant? Then did 2 or more reviewers extract the data independently? Then are the results consistent from study to study? Then is there an assessment of publication bias? For example, there can be funnel plot analysis, there can be forest plot analysis. So you will say that proper statistical methods were used, because when you are making a study, Then the results are not analyzed by just one person. Two independent people, they will assess the results of study, and if they are agreeing on some points, you will say that they have these results. Okay. So the study, if you want your study to be valid, then the reviewers, they should extract the data individually, independently. They should not say that, okay, if you have found 25 patients with ruptured uterus, I will also write in my study that I have seen 25 patients. Not like this. So the both, they should analyze the study independently, and then they can combine the results, and then it can be analyzed. Then what are the results of the study, and how precise are the results? To see that what is the precision you are going to use, confidence intervals. Then the third question will be, will the results help me in caring for my patients? Mm-hmm. No, it's okay, yeah. Yeah, yeah. You know what you can do is that if you are attending from phone, then you can, yeah, yeah, log out and log in again. You can do that. Take your time, log out and log in. Same idea, okay? Go out and then join again, okay? Hello, hello, can you hear? Oh, okay, that's good. So, we are talking about the results of a meta-analysis. So, first question will be, are the results valid? So, does the article address a clearly focused question? Okay, what is the question? Then, are the criteria used to select articles for inclusion appropriate? Then, is the literature search comprehensive? Like you will give reference of the search, there is a database like Medline, Embase, Cochrane, Sinhel, and searches for abstract, hand searching, etc. Then, is the validity of the included studies appraised? So the same type, that you don't have to analyze, you don't have to start from the beginning. You will just say that, well, that this study is valid. Then, did two or more reviewers they extract the data independently? Then, are the results consistent from study to study? Then, is there an assessment for publication bias? You will have to see that. Then, which you can assess by using different analysis like Morris plot or funnel plot. Then second question will be, what are the results? What are the results of the study? How precise are the results, which means what is the 95% confidence interval? Then third question is, will the results help me in caring for my patients? So the questions will be, can the results be applied to my patient care? Then are all clinically relevant outcomes considered? Then are the benefits worth the harm and cost? This is the one question you are going to ask in all studies. So that's how you are going to comment on these three different types of papers. Then I think we read about the patient information leaflet before. That one was simple, so we will stick to that one. Okay. Then for the audit also, okay, let's go back to this one. Just a quick review. Usually they will give you a study, but on one station, if they give you a study, then on the next one maybe they will give you some patient information leaflet. So PIL, it can be appraised under the broad headings of validity, clarity, credibility, currency, and format. At the end of assessment, do not forget to provide an overall judgment on the quality of the information leaflet. For example, you may state, in summary, this information leaflet, it has many strengths. You will say a couple of them, that this is updated, good evidence, good source, and more helpful for patients, and a few minor weaknesses. You will mention that, but this group was included and they have no information for a certain group. Okay. And thus, with minor modifications, I would be happy to use it with the patients that I look after. So then we should see what is the aim of the PIL. Is it clearly stated? Then how varied is the information? Like the information is accurate and comprehensive. Then are the sources of the information given? For example, if it is by some special group, by like in your case it is from European Board, from the MRCPI, from the RCOG, so you have to see that who has developed that paper, what is the source of reference, source of information. Then is it clear and how the information has been presented. So since this is patient information, leaflets are for the patient, so you should see that they are written in a simple language and they didn't use any medical terms, no medical jargon. Then do they have any diagrams, because diagram will be very helpful, and do they have any color coding, because patient will know that in which group she falls. Then does it have boxes and bullet points? Then have the authors used a question and answer format, because this is helpful. If they have if they will put it under the heading of frequently asked questions, then it is going to be very helpful. So have they provided useful summaries, ideally at the beginning, and then they should conclude in the end. Then has there been a good use of the color, like we said that they are putting them in the risk zones. Then is the paper credible? It means that the authorship, who is the author of the patient information leaflet, it is given or not. So we cannot say that this patient information leaflet was produced by Dr. X or Dr. Y society. Actually, they need to give the names of the doctors. Okay. Then is there a conflict of interest declaration stated by the author? It is especially important for any PIL that carries recommendations for commercial products including specific drugs. So you have to see that no one has received money, any funding, any trips from some pharmaceutical company or from any hospital, because then we will say, because then maybe the author will say something good about that product because he has received money from the company. So then we have to see that is it current, like what is the date of the creation. So there should be an expiry date also, that this information is good for next 2 years and then it will be reviewed in 2021. Then what is the format? Basically it should be A5 size or it should be smaller, and then what we need to do so that it can be fit in the handbag of the patient. So is there a section on further information and help, and there should be contact number, there should be website, everything should be there. So in the end again you will see that there are these are the good points and these are the weaknesses in this paper. So after making a few changes I can use this one in my study. So we will revise this information on audit, that if you are asking you how you will do an audit, so what should be done. So if you understand the 6 steps of an audit, then designing or appraising an audit, it becomes an easy task. So what are the 6 steps? We should suppose that we are doing audit of colposcopy, referrals from primary care to secondary care as an example. Okay. So first of all we have to define criteria and standards. So many people are confused by the difference between the tests. In cases of retrospective studies, they are quicker to do, but there may be a great deal of missing data because maybe the persons they didn't complete her forms appropriately. Okay. Uh, if you will listen to this audio and still any confusions, you will tell me. Okay. So we were talking about the audit. First of all, you have to set a criteria and a standard. Okay. Criteria. Okay. Okay. Voice. Okay. Okay. So okay. So when you are going to do an audit, they will ask you that how you will assess an audit. So there are different steps in making a good audit or appraising it. First of all, you should define criteria and standards. For example, if you are doing a study on the women who have like this cervical dyskaryosis on colposcopy, So what you can do is you will say that in which patients you are including. You are including those women who have moderate dyskaryosis and they have one abnormal smear. So you have made this one that these patients they should be referred for colposcopy if they have a moderate dyskaryosis and one abnormal smear. Then you will search for the standard. We know that for cervical screening, the standard is that the patients in these circumstances they should be seen. 90% of the patients should be seen within 4 weeks of the referral. So criteria and the standard, they should not be confused. Criteria is according to what we are selecting our patients, and standard is that what is expected that you should do in a good hospital. Then how you will practice, you make current practice. So decide whether you need this measure will be prospective. It means that you will follow the patients. So what is the benefit? That the data will be more complete, and this approach may suffer from the hot horn effect of improvement in practice while the audit is being conducted. Or if we are doing some retrospective study, then we will get the results very quickly, but maybe a great deal of the data will be missing. So consider the sampling frame, all in a defined period, they are random or what. Then consider the sample size. So people often discuss power calculation. This is not very helpful. You will just say that what is the sample size. So you can decide this on the size of the sample, or you can say that we will review our practice when we have 200 patients, or you can say that if we are following the patient for 1 year, then we will include them. Then you have to talk about the design and pilot the data collection from rule form a pro forma. It should be made as simple as possible and just collecting the essential data for the audit and not looking for interesting facts and burdening the data collector. Just you should know that what should be your question, how you are going to collect everything. Then enter that data into a database, for example on Excel or SSP. Then you are going to analyze data. So then you have to consider possibility of sampling or selection bias. Analysis can be quantitative analysis. For example, what proportion of women with moderate dyskaryosis were referred to the colposcopy unit. Or it can be qualitative. Quantitative when you're talking about the number or the proportions. Qualitative that why were some missed. So you have to maintain a good number and then quality. So you have to decide on the format of presentation of the data, that you will make a pie chart, you will make bar chart, or you will make some proportions. Then you need to present the results. So anticipate reactions. Do this sensitively. Do not assign person blame. Hard on issues, soft on individuals. These things should not be done. You should not blame anyone. Use various methods like audit meetings, hospital emails, letters, quality improvement journals, because you are telling everyone about the changes. So if you're so then in the fifth step, you should identify strategies to improve the provision of care. So you will involve all who are responsible for the care, like the organization, patient committees, your hospital staff. Then consider revising guidelines. Consider multifaceted approach. Consider resource implications. Then you will close the audit loop. What you will do, you will plan a re-audit at an appropriate time to check the changes have been made. This is called process audit. And outcomes are improved. So you will have to make an outcome audit also. So that's how you are going to complete your audit. Okay, we'll talk about it more when we will do some practically. We will do some topics. Okay. So now you can take a 2-minute break and log in again, and then we will do a circuit on early pregnancy complications. Just take 2 minutes and come back. Okay. Okay.